Bacterial and other infectious diseases remain leading global health threats, necessitating prudent antibiotic use while ensuring availability. Inappropriate usage, like for viral illnesses, only selects for resistance without clinical benefit to individuals. On the other hand, when judiciously prescribed for culture-confirmed infections according to evidenced guidelines, pharmacotherapy constitutes an important strategy, lowering morbidity and mortality substantially. This paper evaluates major antibiotic classes commonly used in primary care settings: penicillins, macrolides, fluoroquinolones, cephalosporins, tetracyclines, focusing on key representatives amoxicillin, azithromycin, ciprofloxacin, cephalexin, doxycycline. According to the World Health Organization, antimicrobial resistance already causes over 500,000 deaths globally annually through increasing infections resistant to standard treatment options. Estimated direct healthcare costs of antibiotic-resistant infections surpass $20 billion annually in the U.S. alone. Both gram-positive and gram-negative multi-drug resistance threatens advances against serious infections like tuberculosis. Prudent prescribing when clinically indicated based on susceptibility testing, shortest effective durations, and adherence limit, selective pressure preserving available options. With infections uncontrolled, imposing huge morbidity and costs, judicious antibiotic use remains necessary alongside novel research while practicing utmost stewardship, preserving efficacy through a One Health approach. The oral penicillin amoxicillin demonstrates bactericidal activity against susceptible gram-positive and some gram-negative organisms through irreversibly inhibiting peptidoglycan cell wall synthesis. It treats mild to moderate infections like sinusitis and uncomplicated urinary tract infections effectively according to clinical evidence when prescribed prudently. Adverse effects are mild, usually consisting of gastrointestinal disturbances, rash rarely. Drug interactions through renal elimination modulate dosages cautiously. Via inhibiting bacterial protein synthesis, azithromycin eradicates susceptible organisms at tissue sites concentrating intracellularly, providing 3 to 5 days of single-dose coverage. It treats pharyngitis, pneumonia, and pertussis according to evidenced guidelines. Diarrhea, nausea occur occasionally. Drug interactions limit its use in Brugada syndrome. Organ transplant recipients through QT prolongation demand special precautions. By inhibiting DNA gyrase, ciprofloxacin demonstrates broad-spectrum gram-negative activity, treating bladder and respiratory infections, along with traveler's diarrhea, short-term as per CDC guidelines, importantly. However, tendinitis rupture risks seen very rarely require dose compliance. Resistance development through promiscuous environmental introduction requires judicious clinical use only. Similar to penicillins in mechanism, oral cephalexin expands gram-positive spectrum, including methicillin-sensitive Staphylococcus aureus, through disrupting peptidoglycan synthesis. It treats mild skin dental infections effectively as per evidenced indications. Allergic reactions consisting of rash, diarrhea, occur rarely, requiring prompt medical evaluation and discontinuation. Pharmacokinetic drug interactions through renal pathways demand close monitoring. Doxycycline demonstrates broad activity against rickettsia, chlamydia, mycoplasma through protein synthesis inhibition, effectively treating Lyme disease, malaria, according to disease-specific guidelines in evidenced durations. Photosensitivity, requiring sun protection, and vaginal candidiasis seen rarely. Its use during pregnancy breastfeeding poses risks avoided through judicious alternative selection instead. While adverse effects are commonly mild and self-limiting, the following potential serious risks demand vigilant monitoring. Anaphylaxis involves immediate medical emergency intervention with adrenaline injection and hospitalization. Clostridium difficile colitis occurrence reported with certain broad-spectrum agents requires cessation and potential fecal microbiota transfer if severe. Tendinitis, especially with fluoroquinolones, long-term impose immobilization risks necessitating prompt dose discontinuation once indicated. Drug interactions modulate levels of renally cleared medications with cephalosporins, aminoglycosides through monitoring dosage adjustments cautiously. Embryo-fetal toxicities arise through fetal bone tooth issues, requiring judicious use during pregnancy, breastfeeding. Careful pharmacovigilance under practitioner guidance helps mitigate uncommon but potentially irreversible sequelae through periodic examination, compliant shortest appropriate durations, and non-antibiotic switching if response lacking confidently. While antimicrobial resistance poses major ongoing challenge, multidisciplinary collaboration through prudent new agent development, public health measures, and optimized antimicrobial stewardship offers hope containing this threat substantially through a One Health approach globally, ensuring the continued availability of these life-saving medicines for generations into the future. In conclusion, selective and judicious use of antibiotics, balancing individual risks against clinical benefits, constitutes a necessary strategy, alleviating infections through microbiological mechanisms of action according to evidenced guidelines. Continuous scientific progress and judicious application optimize patient outcomes further through novel modalities, enhanced diagnostic capabilities, and optimized stewardship globally over the long run.